Hello everybody, this is Max Claps with IDC. I lead IDC research in EMEA for the public sector, and in particular today we're going to talk about our initiatives under the IDC Health Insights umbrella. And one of the key items we're working on is our annual PanEuropean Healthcare Executive Summit. The summit has been running now for 3 years. We're organizing the third edition. Is going to take place in Dublin on the 22nd and 23rd of September. And we're really building on a topic that we started talking about 3 years ago, and we're taking it to a practical level this year. The topic is integrated care. It is about integrating and personalizing services offered to the patients at the community level. Integrating the value chain, taking into account hospitals, primary care, but also life science, social services, public health, and so forth and so on. And we're trying to make it real. We discussed for the last couple of years about the theory, virtual care, telemedicine, big data and mobile, and how they could change healthcare service delivery. And we're trying to focus the 2 days of the summit in 2015 on how things are going to happen and what are the practical steps to get there. Day one will focus on the convergence between public health and medical care, for example, taking into account things like evidence-based medicine that create the link between the hospital environment and life science and academic research. And then the second day, we're really looking at the change and transformation in the healthcare organization, in the healthcare provider organization, primarily the hospital, because let's be honest, throughout Europe, the hospitals still account for the majority of healthcare spending and activities and patient visits. So the second day is really focusing on the impact for the hospital and what the future role of the hospital within integrated care. The interesting thing about the event is that to make it very practical, very interactive, we are collecting input and feedback from our advisory board, which includes IT and non-IT and business executives from hospitals around Europe, from public health authorities around Europe. And the 2 days of the event are going to be really interactive. Just 2 or 3 plenary sessions, and then most of the discussions are going to be panels, workshops, so that everyone can contribute. We will favor peer exchange and networking and give the opportunity to everyone to bring their own experience and get value from the peer exchange, and also maybe listening to some of the IDC content. So if you're interested to know more about integrated care and the practical steps in the next 2 or 3 years, please join us at the IDC Pan-European Healthcare Executive Summit, and you can look for further information at the summit website.